It depends on the test you're using. All pregnancy tests measure the amount of human chorionic gonadotropin (HCG), the pregnancy hormone, in your body. Home pregnancy tests detect the presence of HCG in your urine. Some pregnancy tests are more sensitive than others. The more sensitive tests may be able to detect low levels of HCG as early as 4 days before your period is due, or 7 days after you've conceived. The sensitivity of a pregnancy test is described on the packaging as μU/milliliters milli international unit per milliliter. In general, pregnancy tests range in sensitivity from 10 μU/milliliters to 40 μU/milliliters. The lower the number, the more sensitive the test, and the earlier it can detect pregnancy. Every pregnancy is different, though. You'll get the most accurate result if you test around the time your period's due. If you test too soon, even with a sensitive test, the amount of HCG in your urine may not be high enough to detect. Getting a false negative, when a test that says you're not pregnant and you are, can be upsetting and confusing. One woman in 10 can have very low levels of HCG levels at the time of a missed period. If you have a negative result, but still don't get your period, test again in 3 days' time. If you are pregnant, by then the levels of hormone may be high enough to be picked up by the test. The blood test can also detect HCG. Blood tests are more sensitive than urine tests and may detect pregnancy from about 6 days to 8 days after ovulation. However, your GP won't suggest a blood test for pregnancy until after your period is due, and only if there is a medical need. In these circumstances, tests are carried out at an early pregnancy assessment units. Talk to others who are hoping to get pregnant by joining our Actively Trying group. If you think you may be pregnant, check out the top 10 signs of pregnancy, or use our due date calculator to find out when you may be having a baby.